Myself, Dr. Anita Chetan, obstetrician and gynecologist. My grandmother, Lakshmama, aged 99 years, had fracture rib dislocation, for which she underwent surgery at Apollo Sheshadripuram under care of Dr. Vasudev Prabhu, the orthopedic surgeon, who gave us an immense strength, support and care, and always cheerful. Did a surgery of total hip replacement. She was unable to walk on the first day. On the second post-op day, she was able to mobilize and discharged on the fourth day. And she had herself high risk because of her age and fibrous lung, for which the physicians in Apollo took care and the recovery was faster. Apollo Sheshadripuram has world-class amenities under one roof. That makes the patient attender's life easier, and I thank one and all for both medical and paramedical staff for the care they are given to her.
We all are going to grow old. Old age is eventually going to happen to all of us. Joy of old age is when we can overcome the problems and get on with life. Comprehensive geriatric care includes how to prevent fractures, how do we treat it, and how do we take care of them in the post-operative period. Newer ways of treatments have come, whereby we are able to make the patient get back to their near normal life as early as possible. When I did a 98-year-old lady last year, what came to my mind? One, what is the quality of bone? Two, what is the overall status of her lungs, heart, kidneys? Three, will she withstand my surgery? Now we decided that it's the best thing is to get her operated, get her back on the feet. So we fixed the hip last year. She's walking and she's quite comfortable now.